Canada has one of the highest rates in the world of Crohn's disease, and the numbers continue to climb. Our health specialist Leah Sarich now with how the latest research shows early intervention can alter the course of the disease.
Yes,
that's important.
It is really important. So this is exciting news, but let's first talk about Crohn's disease. So what exactly is Crohn's disease? This is an inflammatory bowel disease, and it can be very debilitating. So we're talking about things like abdominal pain, diarrhea, vomiting, weight loss, and more. These patients are more likely to spend time in hospital. Half will require surgery. So that's pretty intense, and almost half will die prematurely.
Wow.
So this is a very serious disease. But a new study that's involved researchers right here in Calgary, again at the cutting edge of research right here at the U of C, they've discovered that starting treatment of the inflammation that causes all of those symptoms, those GI symptoms, if they start that early, this can change the entire course of the disease.
So in the patients that got Humira and combination therapy, as soon as they sort of weren't feeling well, we saw a 26% reduction in complications of the disease, which could be like narrowing of the bowel or the development of fistulas, and we saw a 32% reduction in surgery. And that's only over a period of 2 years. So what it really told us is we have a great tool, right? But it's when you use that tool is probably more important than the tool itself.
Which is really interesting. So he's talking about the drug Humira. It's a biologic medication. It really did change the course of treatment for Crohn's disease back when it came out. So it makes a huge difference down the road for these patients. Dr. Panaccione says it's like investing money early. You know, if you start early, you're going to get the payoff long term down the road. But Humira, for example, it is still a very powerful drug. It is also still very expensive, and it does have side effects, which is probably why some doctors and patients were concerned about starting it early because of these side effects. But Dr. Panaccione says this evidence should help change those minds.
One of the barriers, I think, from physicians and patients to use it earlier was that there are some side effects that are concerning to patients and physicians. But in this trial, there was no difference. In fact, the patients who were on the combination had less side effects because there was less disease-related complications in that group. But the things that people worry about, infections, sometimes we talk about lymphoma, which we usually see later on, right? There was no differences. So overall, the patients who got the earlier use of Humira did better than the patients who got it later.
So there you go. That is some pretty important evidence right now. So now it's just a question of getting the word out to everybody, to doctors and patients, so that they can start changing this standard of care, because if they've proven now that this is going to make a huge difference down the road. So they've just published this research in a very prestigious medical journal, The Lancet, so this is helping. So it's about helping policymakers understand what this means to society. So if you can say, okay, we're going to prevent things like disability in these patients so they can continue working and contributing to society. If you can keep them out of hospital, having those surgeries, that's huge. That's saving money for the long term and down the road. So this is what they want to do now. And the bottom line is this is really good news for patients, because what it means is that they're going to feel better for longer.
Especially those high numbers right here at home.
Right here at home, exactly.
More information, as always, on your
my blog.
Yeah, breakfasttelevision.ca is where you can find that. Thank you, Leah.